My name is Dirk Arnold. I'm medical oncologist, professor at the University of Hamburg. I'm working at the Asklepios Tumorzentrum Hamburg, which is a network cancer center. And I have a, let's say, I will not say lifelong, but quite a long story in GI cancer research, mainly with a focus on colorectal cancer, also leading the German as well as the European group for some time.
We're here talking about the Origami trial. Can you give us an overview of the trial before we talk about the results?
We are doing two randomized phase 3 trials in first line and in second line. So specifically, we do talk about Origami 2. This is a first line trial in metastatic colorectal cancer. So unpretreated patients with the RAS and BRAF wild type status, which undergo randomization one by one to standard chemotherapy plus an anti-EGFR receptor antibody versus standard chemotherapy plus Amivantamab. So that's the research plan we're having. And this trial is planning to include more than 1,000 patients spanning across the globe, more than 20 countries involved, more than 200 sites involved. So this will be one of the largest trials ever in metastatic colorectal cancer. Well, so far, this trial is ongoing. What we have been presenting here is some data from the what shall we say, preceding phase 1/2 trial, which is called Origami 1. And this is a trial which is including patients with various situations with metastatic colorectal cancer, unpretreated, pretreated, then single agent Amivantamab or Amivantamab in combination with standard chemotherapy. And also in terms of molecular characterization of these patients, with the primary tumor being located on the left side of the colon versus on the right side, which is a completely distinct biology. And in all of these 5 cohorts, we have seen surprising signals of efficacy. Of course, it's single agent, it's phase 1/2. And we have also presenting here some biomarker data trying to identify the best benefiting patients from this without putting too much emphasis on that. I think the phase 1 trial results are that strong and that stimulating that the sponsor made the decision to directly hop into this massive phase 3 trial program. And this underlines the efficacy. So in fact, we have seen first-line objective response rates in combination with chemotherapy of more than 60%. We have seen even in refractory, we'll say, pre-treated patients which already had pre-treatment with anti-EGFR receptor antibody, remarkable responses. So given the specific mechanism of action of Amivantamab, this is a strong hint that this is clearly worth being examined in first line. Well, what is maybe for the practitioner important to know is Amivantamab as a drug as such is known in the field of oncology. It is well working also in lung cancer. And the reason why we are, let's say, having this positive notion that it may be successful is what shall we say, the functional mechanism of action by inhibiting not only the EGFR pathway or RAS-dependent MAP kinase pathway, but also MET, which is another target, and also with a strong, what shall we say, immunotherapeutic approach with the active attraction of macrophages and T cells by the Fc fragment of this antibody. So we have 3 different mechanisms of action in one molecule. And therefore, for me, it's a great example of how modern developments in targeted agents can be. So going broader than we had drugs which were developed 10, 15 years ago.